Matthew Holt. It's another TCB Quick Bite. I'm on the HIMSS floor with Aditya Bansod. He is the CTO and co-founder of Luma Health.
That's right.
And Luma Health does what, Aditya?
We do a lot of things, but we produce and provide what we call the Patient Success Platform. The Patient Success Platform is a suite of collections of tools, products, and services that make it easy for health systems and clinics to deliver a journey from the moment that they know a patient wants care to getting care. Simply stated, we make it easy for health systems to get patients' butts in seats.
All right, so I'm going to cheat here. And
yeah, you got the superpower here.
This little form you've got here shows that you do things like acquisition, retention, scheduling, patient communications, appointment reminders, you have a bot, patient intake. However, you were telling me earlier, so let's explain again, you do a lot of this on a bedrock, literally, of anonymized data, and then you do operational stuff. So explain the first part and the second part.
Definitely. So our core products are actually operational products. We help those end users, the operational users, the office managers, whatever it might be, help those patients navigate that way into care, providing appointment reminders, online scheduling, all the different activities that connect that patient from the moment they want care to getting care. But because we've had such a large data set and our partners and customers have allowed us to do this, we've taken over 750 million individual data points of engagement and activity on Luma, anonymize them, and actually use them to crystallize what are the best practices for delivering patient engagement and ultimately patient success inside the health system. So if you're sending an appointment reminder, how many reminders should you send? Is it different by visit type? Is it different by specialty? What words should you use inside the appointment reminder? If you're doing online scheduling, is it a good idea to ask their insurance information before they get booked or after they get booked and they're already on your schedule? What leads to better outcomes? What leads to better completion rates, better show rates, and ultimately healthier patients?
So how much does that sort of the back-end data science bump or influence the operational part of it? Were you doing operational part start first and then doing
We
data
started with the
science?
operational data because that was used to build the data asset, right? The actual making the clinics work better. The way that we do it is because it's an anonymized data source. We produce white papers, best practices. We produce reports that are used by our implementation teams or customer success teams that they use when they're actually working in an optimization phase with our customers to tune all the operational levers. So say this knob to 7, this knob to 2, that lever to 6. That's how it's used on a day-to-day basis. And so that the operational part, the actual running of the clinic that we help make happen, happens more seamlessly and effectively.
So I'll ask you the question I asked off camera, which is that it seems to me that there's a physician shortage, especially in specialty care. A lot of people, there seem to be long waits for a lot of specialty care. Why do they need you? Why don't they? Why spend money on you when there are already people in the?
Because here's the secret. Here's the secret. In any specialty group, any physician group, you go to bed on Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. Your calendar is packed. 8 a.m. to 4 p.m., 9 p.m. to 5 p.m., whatever your schedule looks like, wall to wall. But by Tuesday afternoon, Friday's looking like Swiss cheese, Thursday's looking like Swiss cheese, and there was a patient who was waiting for the slot that another patient had canceled. So Luma, core raison d'etre, the reason we exist, is helping patients actually get to those hard to acquire slots, helping providers run more efficient practices and see more patients. It's never as simple as there isn't enough physicians, patients are waiting a long time, doctors are seeing too many patients. There's always excess slack and capacity in the system. Our goal is to get the right patient from the right provider at the right time.
Okay, what do you think I'll rephrase the question. Over the last decade or so, we've seen the emergence of large, big health systems. Now we're seeing the emergence of these retail clinics, pay riders, all the rest of it. Obviously, you're also seeing some move towards value-based care. I don't know how fast that is. Does that change what you guys do? Does that change the need for these types of solutions?
No, if anything, we've seen the last couple of years the acceleration of the need for our tools. Whether it's a payvider at taking patients at risk, whether it's a large IDN that's cobbled up and hobbled up a lot of different groups, the need has actually just increased because the economics of healthcare have scaled up. And so what used to be a 5-provider clinic and maybe a 10% under capacity utilization was maybe a $100,000 problem. Now at a large integrated group or a large acquired group, it's suddenly a multi-million-dollar question, and being able to get return, being able to get asset equity, getting all the different metrics to work to make those big investments make sense, or even in a capitative model, make that actual economics make sense for the capitative licensed population. The problem actually is amplified in the last couple of years, and we've seen that in the growth in our business.
So you mentioned to me you started with IDNs and university models. health centers, and I'm blank,
FQHCs and primary care.
Primary cares, and then specialists, private equity specialists. What about these new models like the retail players or the Optums of the world who are buying? Is that a place for you to go to? Do you think they're rivals to your current customers?
No, I mean, retail care is really, really interesting, but the key thing that we've seen in retail care is it produces and provides primarily primary and general care. The uplift of specialties still has to go somewhere. So being able to solve for that and make those specialty appointments still work, it still exists no matter what. And then the other side of the house, which are the pay providers and the large roll-up groups, the problem again is the same set of scenario and flavor. To make the economics of that work, you've got to run a great running health center. You've got to run a great running health practice. And the problems are just now magnitude. Instead of hundreds of thousands, they become $10 million problems. And solutions like ours actually help make those $10 million problems into $10 million positive profitability conversations.
So you're telling me when I next call a specialist, I won't necessarily have to leave a message and get called back 3 days
Our
later.
goal, yeah, exactly. Our goal is that we actually send you a message saying, hey, now you're the patient. Would you like to schedule or ready to see you? Click this link, book yourself. Right. That's the goal.
Fantastic. All right. Last thing, tell me about the company. You've been around, you said 8 years?
Since 2015,
how much
three founders.
And you raised how much?
We raised 3 rounds in A, B, and a C, about $160 million of financing, based primarily in the Bay Area. About half our team is across the United States.
And then tell me about customers. How many? Who are they?
About 600 odd customers. They break out about a third, IDNs, academics, kind of the large health systems, a third private equity-backed groups and specialty groups, and a third primary care and FQs. About integrate with about 80 different EHR and PM systems, and and that powers those 600 customers.
All right. So Aditya Bansod. He is the CTO of Luma Health, and very interesting sort of back-end data and operational play that's hopefully going to help fix healthcare maybe a little bit.
Fingers crossed. That's our goal.
Thank you.